You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
You're listening to American Medicine Today. I'm Kimberly Brumell, joined by our friend and radio executive producer, Ethan Euchre.
Always glad to be here.
Yes, Jeff Wagstaff's on the other side of that wall over there, listening and participating from afar. And across from me, we have world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute.
Hello.
And in studio, we have Dr. Adam Scheiner, a world-renowned laser eyelid and facial plastic surgeon in Tampa, Florida. Now, he's been featured on Health Experts and on many national shows like The Doctors and Dr. Oz, and he's here to tell us about the Reset Festoon laser treatment to treat eyelid bags. So thanks for joining us here, Dr. Scheiner.
Well, thank you so much for having me.
Now, you practice throughout the country and then even internationally.
Yeah,
Is that
well,
correct?
I'm based here in Tampa, but I have an international clientele that comes
Yes.
to visit me from around the world, and I love being a resource for all these people.
Yes. Well, we had you on our TV program.
Right.
Which is just aired. But what I never understood what a festoon was. I know for myself, when you're on TV, you always look, when you wake
Dissect
up.
how you look.
Yeah, you go, oh, I think
look
I
horrible.
look tired, or there's puffiness or darkness. Why don't you explain the difference between just bags and festoons?
Right, let's pull back just a little bit. And the thing I mentioned on our little TV show is that, we are very social beings. We love connecting with each other, right? And
Right.
so our faces really do a lot of that for us. We tend to automatically evaluate each other's faces for certain facial cues. When we see heaviness around the eye area, sometimes it can make us appear tired, right? Or sick or older, even if we feel fine inside. And that can be frustrating. People are saying, hey, did you get enough rest? And you did get enough rest?
Yes.
That's frustrating. So, and there's two varieties that we see in the lower eyelid. There are these lower eyelid bags. They form right below the lashes in the lower eyelid area. They're kind of these puffy areas. And then there's a second thing called festoons, and or malar mounds. They form on the cheekbone.
Okay.
And they tend to go really in hand. We see them a lot together. The festoons really have more of a genesis in sun exposure, but unfortunately, a lot of us have got a lot of sun exposure over a lifetime, so we
Yes.
see a lot of it. There's some earlier congenital causes of it that we see in certain young people. Most people, it's sun exposure. So
Got it.
when I'm helping people, I like to help both the lower eyelid bags and the festoons for the best rejuvenation effect.
Okay. Well, you brought up when we were taping for television, you hear all the time people on these talk shows, well, just cut some slices of cucumber or potato and
I've
stick
heard
them under your
coffee
eyes,
grounds.
tea bags, all
Yeah.
different things, and they can reduce,
Puffiness.
the puffiness in bags. That doesn't work for festoons, does it?
Well, temporarily, if
Okay.
you put something there for a short time, for half an hour, yeah, it might be better.
Yeah.
But it's not really, it doesn't get to the real cause of it, so it doesn't
Right.
cause any real changes.
Okay. So no preparation H is going to be able to do what you do.
Correct.
Okay.
If everything you do could be boiled down to smearing some preparation H on it,
Exactly.
that doesn't say a whole lot for you.
Exactly.
Now, with the festoons, with your procedure, is it just like a one-time fix?
Yeah, I was in surgery today, and I had patients from New Hampshire and one from the other side of the state, from Melbourne. But yeah, I do it one time. Their body heals the wound. They create
Okay.
the result, and it's fixed. As long as they maintain their skin safe from the sun, this is a lifetime result.
Got it. You were saying that through the process, using the laser, that you saw other results later on when people came back and they had other lesions that pop up,
Right.
the area that you treated. Why don't you explain it?
Yeah, what I found, sometimes our patients become our teachers, right?
Sure.
So I did this case on a woman. She was a little bit older, in her 60s. I did surgery on her upper and lower lids, and she did great. I did this laser on her skin, on the lower eyelid skin. And then she came back to me 2 years later, and she was erupting in skin lesions everywhere, all over her face, except for this one area underneath the eyes that I had treated 2 years earlier. And it taught me, well, not only am I improving wrinkles, age spots in
Sure.
these things, I'm actually making the skin healthier.
Yes.
So then I started to think about this, and I started to have an eye for looking for skin lesions and skin cancers. And actually, I can use this procedure to dramatically improve the health of the skin. I can put up to the little
Sure.
webcam here. So this is an example of this. Improving the skin. So this woman actually was sent to me from a dermatologist because she had a terrible amount of these different lesions, flaky lesions that they were freezing off for a long time. And then she came to me because she was tired of getting all these things frozen off. Well, with one procedure, I was able to, turn back the hands of time for her.
We should also note for those just listening on radio and not watching that the woman on the left has a ton of sunspots, looks,
Much older.
I don't want to guess an age because you never do that to a lady,
Right.
but she looks, let's say, much, much older. I would say 20 years older than she does after you had done your procedure. It almost looks like her daughter.
Yeah, it looks like a grandmother and then her daughter.
Yeah.
Show us the other ones that you have there in that tablet.
The other ones that I had.
No, show them in the beginning.
Yeah, this is another one that I had done for the same reason.
Right. Remarkable difference.
Show me another one.
And here's a straight on.
That one went back.
Oh, sorry.
And again, if you're listening in your car, here's a reason why you should be watching the stream, because sometimes we have visual
the before
aids
and after photos
that you can't hear.
Look at the difference there.
Yes.
That's pretty unbelievable.
I mean, it's the lines to the side of your mouth. I don't know what that area is
I
called.
call those bulldog lines because they kind of look like, it looks like
they call it, medically they're nasolabial folds or sometimes neolabial folds.
You and your fancy
They
terms.
call it like sometimes puppet lines, right?
Yeah.
That makes sense.
Right.
But yeah, they're completely gone, essentially.
And that's what I love. I love the fact that I can help people not only look better, but make their skin healthier.
You're an artist.
And what type of a laser are you using?
So the one that I use is called a dual pulsed erbium laser.
Okay.
Early on, there were this type CO2 and erbium, and CO2 left residual heat around that was sometimes a problem.
Okay.
Erbium is a very clean laser, and it doesn't leave that kind of heat around, and that's what I like about it.
Hey, how long is the finding between the patient that you have in your tablet on the right side and the patient that is on the procedure on the left side?
Right, that was about 3 months or so.
3 months.
Yeah.
Right.
Okay. So, well, the difference is probably 20 years difference.
Yeah.
And that's what I love. It's like she can live a healthier life now. This woman actually, I talk about this, sometimes it's catalyst for change when we do this. So this woman actually lost a lot of weight. She's got into exercise. And, it's great that this can be a catalyst that
It's
way.
amazing for the soul of the patient.
Yes.
People don't really understand the way that you age is by you looking yourself in the mirror. If you look in the mirror yourself and then you start to see aging, then you start to accommodate to that aging, and then suddenly you get in a situation that you accept that aging, and then you become old.
Right.
Now, people that they don't do that, they usually do this type of procedures, and then suddenly it's like you rejuvenate, but you don't rejuvenate your face. It's
the
all
soul.
your body.
Yes.
Your soul goes and say, I'm young again. And then you don't tolerate your body to lose energy or to do things that they practically make you old.
Right. And that's what I find, too, is that, so much of us, it's frustrating. That's what I love about it. For me, these procedures are not about vanity, okay? It's about communication. We all want to connect with each other. If we look... there was this funny video that was out there called the resting bitchy face. I don't know if you saw that.
Yes.
Right?
Which I get accused of having all the time.
Right. And so it's not fair that someone looks bitchy when they're not bitchy, right? And so the things that, for me, it really spoke. I wrote a whole blog about this because there's a deeper meaning to this. We want to connect with each other. We are these very social beings, and these connections are very critical. So we want our inside to kind of match the outside message that we're giving out there. And that's what I love doing, helping people make those things match.
Okay, well, let's be vain for a second. You go through the Festoon procedure, some of these other procedures you do on the face. Is there scarring involved?
Well, when I do this, in most cases, they heal beautifully.
Okay.
Sometimes people in fall directions, there can be little scars. I have waist treat scars too, so I take care of everything.
Okay.
Yeah.
One thing that I found really interesting that I've never even heard of is that you do basically a 5-minute rhinoplasty, like a 5-minute nose job.
I do.
How in the heck do you do something like that in your office?
Well, what I like about this is there are sometimes people who've had nose jobs that don't work out right.
Right.
And it's hard to finesse them back surgically. But, the way that light plays off our face, the thing about an art, it's about light and shadow, right? And so I can use these soft tissue fillers that we have, like Juvederm, Restylane, Radius, and such, and I can put them in the areas where it's missing, let's say a nose. I actually have to envision the nose and think about ways I can make it straighter. And so I can help with nose bumps, crooked noses, wide noses. I mean, I've had African-American wide noses, and I put a light line down the middle, and it tricks the brain to see it as more narrow. And then my favorite thing is really these people who've had bad nose jobs where I can fix them also. And help the irregularities. I had this one woman, she was about 23 or 24 years old. She had a nose job that went wrong, and it was terrible. And I love the fact that with this, I mean, she's a gorgeous girl, but this thing was way out of proportion to her face. So with this procedure, I was able to fix out all these contour irregularities. I love helping.
And how long does that last?
Yeah, that's usually about a year. Although I will tell you, some people build collagen around it. They hold on to it for years.
Wow.
One of the things that happen with the laser when you expose the skin to laser, I'm going to ask you if that is your experience. One of the problems is that they go to sun and then they have more damage on the skin, and they create some black spots and things like that. Is that something that happened with Erbium?
So with any sort of procedure that we do here, it's brand new skin. It's like baby skin. And so you have to protect it. So yeah, they have to use sunblock. If someone has a lot of pigment in their intrinsically in their body, yes, they can have issues with pigmentation, and that's why I really coach my patients to be very critical with the sun exposure.
And you've said that you even tell your own children to put sunscreen on every day, even to go to the mailbox, things like that.
Absolutely. Well, that's how we keep ourselves healthy a long time, right?
Yeah.
Yeah.
It just seems like a step that I would never think of.
That's why I don't look my age, right?
Okay.
Yeah.
I don't know your age.
Not to bring up another long topic. Sorry, Ethan.
Oh, here we go.
But some of the other treatments that you have to remove sun damage, there are things that don't have a lot of downtime, so somebody can come in for a procedure, and you said they can pretty much go right back to work.
Right. There's this thing called broad-based light. Real quickly, it's something to help with skin spots, red spots, brown spots on the face, but we found from studies from Stanford it's actually caused the skin to revert back to a younger genetic state. So we thought it was just all cosmetic, but it's actually making the skin healthier.
And Dr. Scheiner, how do people get in touch with you if they are interested in getting any of these procedures we were talking about?
Yeah, my website is probably the best way, which is www.adamscheiner.md.com. And that's ADAM Scheiner, SCHEINER. And really, I have so much stuff out there. They can find me just by putting my name on the internet. They'll find me.
Some great videos and things like that as well.
Exactly.
So, perfect.
Well, thank you. It's a great time always. Thank you for joining us. Again, Dr. Adam Scheiner, renowned laser eyelid and facial plastic surgeon here in Tampa.
Thanks, Doc.
Hey, thank you guys so much.
Thank you.
Have a great day.
You're listening to American Medicine Today. If you or someone you know is suffering with neck, back, sciatic pain, headaches, RSD, fibromyalgia, whiplash, reach out to Bonatti at Bonatti.com or 855-267-0483. Coming up after the break, you're going to hear more probably on politics. Stay tuned.